Good morning class. Today I deal William tumor part 2. So what is William tumor? Is the type of kidney cancer that occur in children. William tumor is the most common of childhood kidney cancer. The exact causes is unknown, but the missing iris is the birth defect that is sometimes associated with William tumor. So today I deal management portion of the William tumor. So first is combined treatment, surgery and chemotherapy with or without radiation based on histological pattern and clinical stage. In combined treatment, so first ideal surgery for William tumor may include removing part of the affected kidney. Partial nephrectomy involves removal of the tumor and part of the kidney tissue surrounding it. A partial nephrectomy may be an option if the child cancer is very small or if the child has only one functioning kidney. Again I am telling, in surgical management, removing part of the affected kidney. A partial nephrectomy involves removal of the tumor and part of the kidney tissue surrounding it. A partial nephrectomy may be an option if a child's cancer is very small or if the child has only one functional kidney. Next is second is removing the affected kidney and surrounding tissue. In a radial nephrectomy, a doctor removes the kidney surrounding tissue including the ureter and adrenal gland, lymph node, etc. and removing all part of the kidney. If the William tumor or kidney cancer is spread in other organ, the child cancer affected both kidney, the surgeon work to remove as much cancer as possible from both kidney. In a small number of cases, this may means removing the both kidney, which means the child would then undergo kidney dialysis. This is a main management of surgical intervention. First is removing part of the affected kidney, then removing the affected kidney and surrounding tissue if the surrounding tissue is affected, and removing all part of the kidney if both kidney are affected. Then chemotherapy. So what is chemotherapy? Chemotherapy are useful. Chemotherapy uses powerful drug to kill cancer cell throughout the body. Chemotherapy treatment usually involve a combination of drugs that work together to kill cancer cell. Chemotherapy can be administered through a vein or taken in a pill or tablet form. The side effect of chemotherapy: nausea, vomiting, loss of appetite, hair loss and frequent infection. Chemotherapy may be used before surgery to shrink tumor and make them easier to remove. Chemotherapy may be used after surgery to kill any cancer cell that may remain in the body. Means before and after we can give chemotherapy if patient or if baby need it. Then if both kidney are removed, the preoperative chemo and radiation and partial nephrectomy of less affected kidney and total nephrectomy of affected kidney, then transplantation of the kidney, then post-operative chemotherapy. So in radiation therapy, what we can do? Radiation therapy use high energy beams such as X-ray or kill cancer cell. During radiation therapy, the child is positioned on the table and large machine move around the child affected area. Possible side effect including nausea, diarrhea, fatigue and sunburn like irritation. Radiation therapy may be used after surgery to kill any cancer cell that were not removed during the operation. Radiation therapy may also be an option to control cancer that has spread to other body organ, depending on where the cancer has spreading. Next is prognosis of Wilms tumor. Wilms tumor often become quite large before they are noticed. The average nearly found Wilms tumor is many times larger than the kidney in which is started, because it is spreading. Then most Wilms tumor are found before they have spread. It means metastasized to other organ. Prognosis is good before metastasize. If uh, if surgical intervention is proper in a time, so prognosis is good before metastasis. Then nursing management, support during the time of diagnosis, patient, baby and their relatives, prepare for the surgery if no preoperative chemotherapy remain, lab on either investigation, physical and emotional preparation of their parents, give teaching and psychological support their parents, preoperative observation, no palpation of tumor unless absolutely needed, management related to chemotherapy and radiation, which means no palpation in a tumor site, because if we palpitate in the affected area or cancer area, they need management related to chemotherapy and radiation therapy. So other points of nursing management: monitor intake and output, initiate nasogastric tube, assess, order and provide tube care. The child is an increased risk of injury for the tumor. Do not focus on the pain for the surgery. Dietary and nutritional consideration, progression of the normal diet. Then monitor the incision of the sign of infection, erythema, drainage or separation. Nursing assessment, and bowel sound should be accumulated carefully to detect for hypoactivity and monitor for obstruction. That is all about nursing management of Wilms tumor. So summary. So I summarized Wilms tumor. Wilms tumor is a kidney cancer that is most common in childhood kidney cancer. Wilms tumor mainly, their causes are unknown, but missing iris of the eye is the birth defect that is sometimes associated with Wilms tumor. Then risk factor or causes of Wilms tumor: being black, children has slightly higher risk of developing Wilms more than do children of other races. Having a family history of Wilms tumor and under descendant testicles, then hypopediasis, this all are a high risk of Wilms tumor. Then stages of Wilms tumor: stage 1, the cancer is found only in one kidney and generally can be completely removed with surgery. There is 5 stages of Wilms tumor. First is cancer is found only in one kidney and generally can be completely removed with surgery. Stage 2, the cancer has spread to the tissue and structure near the affected kidney such as fat or blood vessels. Third stage, the cancer has spread beyond the kidney area to near lymph node or other structure like abdomen, and it may not be completely removed by surgery. Then stage 4, the cancer has spread to distant structures such as lung, liver, bone or brain. Then stage 5, cancer cell found in both kidney. And their sign symptom: abdominal swelling, abdominal mass can fill, abdominal pain, fever, blood in the urine, constipation, swelling and discomfort, nausea, loss of appetite, hematuria, high blood pressure, sometimes high blood pressure, and increase and uneven growth of one side of the body. Then diagnostic evolution, firstly we can take history taking and physical examination and blood and urine test, imaging test like CT scan and MRI, then surgical intervention, then treatment and in medical management, and antibiotics such and antiemetic such as Jofer may be administered to treat nausea and vomiting, and antibiotic for prophylaxis may administered to prevent infection or post procedural incision. Then in surgical management, firstly removing the part of affected kidney, and second removing the affected kidney and surrounding tissue if surrounding tissue also affected of cancer cell. Then third is removing all part of both kidney if both kidney are affected in cancer cells. Then surgical intervention or chemotherapy, with or without chemotherapy. So what is chemotherapy in Wilms tumor? Chemotherapy useful drug to kill cancer cells throughout the body. So and radiation therapy use high energy beams such as X-ray to kill cancer cell. Then nursing management, to monitor intake output, initiate nasogastric tube to and do dietary and nutritional consideration, psychological support, monitor the incision of sign of infection and erythema, etc. So it is all about Wilms tumor. Thank you.